All right, well, welcome everybody. I know it's a really busy time. My husband's in the fields as well, but thanks to those who were able to tune in. And thank you, Carrie, for the introduction there. So I guess I don't need to say much more. She really covered a lot of it, but I work at OSU Large Animal Services. So I am based in Marysville, and we do all large animals. So you can see the array of critters that we work on. We tease that if you can ride it, eat it, or wear it, we will work on it. So at the clinic here, I do probably 80% cattle work, and then a good bit of equine from there, and then a little bit of anything else that anyone needs seen. But a good bit of what I do is cows. I have dairies usually in the morning, and then beef work in the afternoons. So I really enjoy what I do a lot, and I have been at Ohio State for 4 years now. Before that, I worked in private practice for a couple years. I worked in a mixed practice up in Northwest Ohio. So I love being down here. I love having students, and I really enjoy teaching. So I'm very excited to spend some time with you guys this evening. Again, I will echo Carrie's comments that any questions that you've got, she's going to help monitor the chat box. And if you have any problems finding the chat box, sometimes at the base of your screen, you'll see a chat. Or if you don't see that in the when you hover over the fields, you can go to more and there should be a chat item. So just wanted to kind of touch on that. And I just see this question here. This, to my understanding, doesn't count towards quality assurance for the fair. That's going to be a different subject. This is more vaccine protocols and things that you can do at your farm, or even if there's some things that you want to change to implement. So with that, again, thank you guys for tuning in. We are recording this so that you have access to it later. And there also will be access to a Word document that will summarize the vaccine comments as far as cows, calves, heifers that will be sent out, that will have everything in a front and back format so that you don't have to feverishly take notes this evening. And you'll have access, again, to the presentation, and then that Word document can be posted for everyone to print off to be able to use that as a resource. So just wanted to let that be said so that if you missed anything, don't worry, it'll come to you in that Word document. So don't get any calluses taking notes. All right. So I guess I'll go ahead here and let me get the presentation, click on there. If you guys would like, through the chat there, who currently has a written vaccination protocol and or deworming protocol for their farm? I can tell you for me on my side, when I first arrived down here, I didn't have a lot of clients that had written vaccine protocols and deworming protocols, and it's something that over time and going through appointments and coming out for checks, we started getting things in place. So what we're going to cover this evening, I don't see that I've got anyone commenting, but I'll take that as maybe not too many. So what we're going to cover this evening, I think, will be very easy for folks to apply. And this is all going to be very basic information. And from there, you'll be able to build and tailor it to meet your own herd. So to get started, when we talk about giving shots, I always like to explain to folks what these different abbreviations mean when you're looking at them on the back of a vaccine box, or if somebody's talking and using jargon with you. IM is intramuscular. The SQ, that is subcutaneous. IN is intranasal, so that means going down the schnoz there. And most of our intranasal vaccines, initially those came out that you had to put 1 ml in each nostril. And that was really just a good way to really make the animal pretty frustrated. So all of those, you're fine shooting it up 1 nostril. The PO is orally and IV is intravenous. So this I guess is your BQA advertisement for the evening. This is a BQA picture here about where to give those shots. So we really prefer up on the neck when we're working with our beef animals. And when we look through those columns, that green column is the intramuscular site that we would be giving shots. And for our intramuscular shots, you can see that area is a little bit smaller. You really want to be a good hand's breadth in front of the shoulder giving those so that you're getting a good muscle belly. for that injection to be able to dissipate, especially giving large volume injections. And on those, you're going at a 90-degree angle and giving your injection. Your sub-Q site, that one is larger. It's defined by the nuchal ligament, which is the ligament that connects the withers up to the head of the cow, the shoulder, and then the spinal column. Their spinal column is very low in their neck there. And anything within that region is going to be your sub-Q site. And giving subcutaneous shots, I do not recommend that people tent the skin where you grab the skin and pull it up and poke. That kind of serves for two purposes. One, if the animal jumps, you're likely to poke yourself. And then secondly, if they don't jump, but you've tented the skin and poked really hard, you might just go through and shoot your injection on the ground. So what we recommend for those sub-Q sites would be like an 18 gauge, 3/4 inch needle, use a 45-degree angle and poke and go. That way you aren't using that tenting method. So just wanted to touch base on that because a lot of our vaccines are going to be really based off of the intramuscular, sub-Q, and intranasal routes. So that's the talk and the BQA for the evening. So we're going to keep rolling. Make sure if you are ever not sure about what route something should go, it's going to be on the back of the product label. So if you've got a vaccine or some sort of antibiotic, anything like that, look at the back of the product label and it'll tell you what direction that needs to go. So additionally, talking shop, when we are working with vaccines, we have modified live vaccines versus killed vaccines. And I think this is very important to cover for folks because these vaccines have advantages and disadvantages. And when I give this presentation with the students, I make them explain it to me, the advantages and the disadvantages, but I'm just going to lay them out on the table. So for our modified live vaccines, the advantages of our modified lives, that's where we've got like a picture of what's down in the corner here. We've got some sterile diluent, which is going to be either a saline or sometimes there's a killed product in that one that we have to pull up and rehydrate the pellet that is in the other vial. With our modified live vaccines, we get very long duration of immunity. And a lot of these products are labeled sometimes for just a single dose. So there can be some advantages with that. The disadvantages with our modified live products is that many of our respiratory vaccines, which is what we'd largely be going to with this sort of modified live, those products are going to come in a 5-dose tub, and they don't come much smaller than a 5-dose tub. So if you've only got a couple animals that you want to do, you end up having to throw some away. And once you have reconstituted or mixed that product, it's only good for a few hours. So it's something that once you mix it, if you're going to be vaccinating cows after lunch, mix that before you go out and vaccinate cows. Don't mix it that morning. It's only good for a few hours once it's mixed. So if you only have 3 to do, you end up having to throw the rest of it away. And that's not the end of the world, but a lot of us as farmers really do not like to do that. But it's important to keep that in mind. Additionally, some risks with our modified live vaccines is that they can cause abortion. So if I've got a naive cow, meaning she either is new to me and I have no vaccine history, or I just know she's never been vaccinated, if she is pregnant and she receives a modified live vaccine, especially one with IBR in it, that can cause her to abort. So there's some advantages as in, a really long lasting good immunity, and the disadvantages then when it comes to handling and the potential for abortion. She even can abort, let's say you vaccinate a nursing calf that is on a cow that is bred, but has not been vaccinated. That calf can shed enough of these viruses after it's been vaccinated with a modified live to cause abortion in the dam. And believe it or not, that is all on the label. We'll touch on that later, but just important things to cover when it comes to picking out vaccines for our cows. So we're going to do a compare and contrast with our killed products. Our killed products are ones, largely like if you were to go into Tractor Supply, a lot of what you're going to see in that vaccine fridge are killed vaccines. They are not vaccines that need to be mixed or reconstituted. You can just draw them up and go. And if I've got a 10-dose container and I draw out 3 doses, I can put those other 7 doses back in the fridge. So the handling is very convenient. They still, same thing, you want to keep them cool and make sure that we're handling everything according to the temperature that it's designed to be kept at. With our killed products, we do not always get the same duration of immunity as we would with our modified lives. So that's potentially a disadvantage, but something that we have to think about when we're weighing our modified lives versus our killed vaccines. But really the salient message that I want to leave you with on this slide is just to remember on those modified lives, once they're mixed, you need to use them, and to avoid any pregnant cow without a previous history. Okay, so I think we just got a couple more house cleaning items here. When we are talking shop on vaccine types, we have bacterial versus viral vaccines. And when we start talking about the vaccines that we just baseline recommend, combined with if you're saying, I've got a lot of cows that come and go and I want to add on X, Y, and Z products. Once we start stacking a lot of vaccines, we can overwhelm that cow when it comes to our bacterial side. Bacteria largely are lumped into lots of categories, but we're going to keep it very simple. When we're talking about vaccinating cows, we have gram-positive and gram-negative vaccines. And on our gram-negative vaccines, this arrow that I've got, that goes to this extra little layer that's on top of this gram-negative, LPS stands for lipopolysaccharide. That lipopolysaccharide, or LPS, causes a lot of inflammation to animals. So when we are designing protocols or trying to figure out how many vaccines can I stack at one time, we don't want to ever stack more than 2 gram-negatives on a day. If we start stacking too many gram-negative bacterial vaccines, once we get up to 3 or 4, it's just not effective for that cow. She's been too overwhelmed. She's not going to be able to respond to those vaccines. So we've kind of squirted money down the drain. And then the other downside is that we could make her sick by causing all that inflammation. So we don't want more than 2 gram-negative vaccines, and we'll spell those out a little bit later in the presentation. So that's on our bacterial side. On our viral side, we've got options on that viral side that are both modified live and killed. We don't have any of those same rules as far as not more than 2 at once, but it's very important that we understand that we don't want more than 2 gram-negatives on a particular vaccine day, because it makes our cows very, very sad and very, very sick. So keep on rolling. I touched on this a little, but I'm going to dive into it. When it comes to your vaccine handling, after you've purchased your vaccine, if you're out running errands and the feed store was the first place that you stopped, to make sure that you've packed a cooler with you so that you can keep everything nice and cool. We want 37 to 45 degrees for our vaccines. And for our modified live vaccines, make sure that you use them after they've been mixed. For our killed products, I'm also guilty that I'll pull up a dose and put it back in the fridge and hope to use that next fall. Ideally, we're going to use those within 3 weeks or kind of within a month of opening. Once that bottle has been opened, the efficacy decreases and that product isn't the same product 1 month later. So if you've got those killed, and I'm sure we're all probably guilty that we've got that bottle of some 5-way or 10-way that's been in the fridge for months and months and months, and we can't quite remember when we used it last, probably the best thing that we can do is toss that product. And that's hard to say. But once they've been opened, or if they've been tapped into multiple times and maybe we didn't use a new needle each time we drew up from that tub, make sure that those killed products, we can hold on to them, but once you've opened them a few times, again, toss them within about a month. If a vaccine is ever frozen, you do not want to thaw that. And I'm going to say especially for gram-negatives. One, it really, really decreases the integrity of that vaccine, and it extremely increases the likelihood that you're going to have adverse reactions. So do not thaw frozen vaccines, especially if you're ordering from a company. Let's say you ordered from PBS and they sent you vaccine and it got sent to the farm instead of your door and nobody found it in time and they froze. A lot of those companies will work with you to get you taken care of because they don't want you to use a frozen product either. So do not thaw vaccines. If they freeze, you need to get new, and folks are generally pretty understanding with that. Again, make sure that they're stored at the correct temperature, and I typically recommend that we do not store these vaccines in the door. That's a good place to store them in general because they're small and they fit in those little cubbies, But when we think about for our fridge doors that open and close and open and close and open and close, that temperature can rise. So if you're using a fridge, especially, you know, just your regular fridge that's in the house, and you're home from quarantine and your kids are in the fridge, in and out of that fridge, the door temperature gets too warm. So make sure we keep our vaccines in a cool part of the fridge and in a place that's not stacked in so tight that warm it, you know, that it'll get too much warm air condensed. And that's more so important. Let's say that you were harvesting warm colostrum and sticking it in the fridge. You don't want to set your vaccines next to that because they could get too warm. So just think about those handling facts. That way, once we finally do get standing next to the cow with our vaccine, it's ready to rock and roll and we don't have to worry about the efficacy of it. All right. I think this slide here hopefully will be very helpful for folks. I think it being very confusing on how many ways are there to vaccinate a cow. So this is breaking down that jargon. A lot of times when folks say a 5-way, they mean a 5-way respiratory. And the 5 things that are in your 5-way respiratory are BRSV, or bovine respiratory syncytial virus, IBR, which is infectious bovine rhinotracheitis or herpes, PI3 for parainfluenza 3, and then BVD types 1 and 2. So when we think about those, that makes 5. So that is a 5-way respiratory. We also have 5-way lepto vaccines, and that has 5 different strains of lepto in it. It has Canicola, Grippotyphosa, Harjo, Ictrohemorrhagiae, and Pomona. That does not include, you might notice if you're looking online or when you've been shopping for vaccines, they might have a, you know, we'll look in the bottom corner here, like a Bovishield Gold 5. Well, there's also a Bovishield Gold 5, L5, meaning 5-way lepto, and then they'll add on HB. That HB is called Lepto Harjo bovis. And if you are wanting that vaccine included for Harjo bovis, that's not in your generic Lepto 5-way. You actually need to make sure that you have a product that has HB on it. Your regular Lepto 5-way has the 5 strains of Lepto that we just discussed. I'm not going to go into a lot more detail because it starts getting a little academic at that point, but 5-way respiratory, 5-way Lepto, when we combine those, we call them a 10-way. So our 10 ways that we are frequently using in our cow-calf operations covered for those 5 respiratory diseases are 5 strains of Lepto, and we call it the 10-way. If you have a 9-way, it's likely that one type of BVD has been left out, just to answer that question for you of about what the difference between a 9 or a 10-way would be when it comes to these respiratory lepto vaccines. And in our vaccines, our respiratory and lepto, that's frequently put in combination. And that's something, again, that we would use for a cow-calf operation. You'll find folks that are just feeding out steers, they'll go just with a plain 5-way because they're not as worried about the lepto as far as repro goes. So the difference between a 7 and an 8-way vaccine. A 7-way vaccine is a Clostridial vaccine. It's got 7 different strains of Clostridium in it. However, your 7-way does not have tetanus. And I'm going to pause and make this a dramatic point to say the 8-way has 8 strains of Clostridium in it and includes tetanus. So if you guys are banding calves or processing or anything like that, you want to make sure that you have an 8-way when it comes to your Clostridial vaccine, or a CD&T. A CD&T is Clostridium, C and D, and the T stands for tetanus. So that's very important, again, for anybody processing calves. But that's your 5-way, 10-way, 7-way, 8-way, what all of that means. That way, when you're at the feed store or at Tractor Supply looking at their vaccine fridge, you can start to make sense of what these numbers on the bottles mean. All right, and again, I'll echo, if anyone has questions, feel free to type them in the chat. I am happy to answer them throughout the presentation. I think sometimes it's easier to ask and answer when we're on the slides with these. So again, feel free to use that chat feature. If you have any questions, I will pause and get them answered. Okay, so now that we've got some of that talking shop and understanding how we're going to be giving vaccines and what routes, how we need to handle the vaccines and what these vaccines mean, we're going to jump into a sample protocol. Again, this is a very generic protocol. This has the baseline things that I think are important, that for my cows at home, I make sure they have these vaccines. As we're going through, this is set up for a spring calving. So, cows that have been calving from, kind of February through May, June, that's what this protocol is designed for. So you might have to change some things around if you're a fall calving herd or if you have multiple groups. But just wanted to make sure folks were aware of that when it came to implementing it at their farms. So we're going to go through each group one at a time here. I've got some shameless plugs of some of my clients' animals just throughout to kind of break up the monotony. So when we have calves that just hit the ground, so ones that are wet like these calves in the pictures, we want to make sure that they're up and nursing within 4 hours, that we get them identified with a good ear tag to know which dam they came out of. And then we can use an in-force or a nasal gin. These are intranasal vaccines, and these give us respiratory coverage. So these are going to work against things like BRSV, IBR, and PI3, which are those 3 biggies when it comes to our respiratory viruses. On those particular products, again, I've got that it's a denote optional. You can see that little star that's on the screen. I do recommend those for folks that are spring calving in January and February, which in Ohio, that's definitely not spring temperatures. So a lot of times we've got calves that might be in close quarters in the barn, and maybe it's drafty or maybe it's really the opposite and there's not a lot of fresh air. Those are times that I recommend we're utilizing these respiratory products or using these intranasal products on these calves at birth. Doing it at birth is safe. It's going to get you a reasonable amount of protection. The intranasals given to calves at birth, the BRSV, probably that component likely starts to wear off around a month, but a lot of those others should linger for a couple months. So just to give you an idea of how long of time that you're going to have using those intranasal products. But again, if you are calving this time of year out on a green pasture and there's an acre for a cow-calf pair, it's not as big of a consideration for you. Similarly, if you are calving in a little bit of a dirty pen or a bedded pack, anything like that, or even just, it's a little bit of a muddy pasture, I always recommend iodine dips for the navel. You can use iodine dip, chlorhexidine, or there is a navel guard product that are out there, and those are all very effective products. It is important, though, that we don't just go to Walmart or some other big box store and buy the iodine that is there. To use a 1 or a 2% iodine or a 2% chlorhexidine, those are scrubs. Those are designed for washing our hands and cleaning them up. We really want the drying agent. So a 7% iodine, one, it has a lot more iodine. It also has alcohol in it. And that alcohol is the drying agent to dry up that navel. So if you're having any navel infections, if you're having any issues, that'd be one thing to look at and check to make sure that you're using the appropriate product, but want to make sure it's an iodine dip or chlorhexidine, like a 3 or 4% solution that you're using on the umbilicus of that calf. Sometimes mamas just lick it off. Maybe you have to apply it once more. But again, something to maybe put on board, especially if you've had any problems. On your calves, when you're processing them at birth, a trace mineral or selenium injection can be a good idea. Selenium, in Ohio, we are in an area that's deficient, and I always prefer to feed selenium. I prefer to feed minerals in general, and this I haven't been endorsed by Purina or anybody else to say that, but I think feeding minerals is always the best. However, these calves are just going to be nursing mama, and her milk can be void of certain minerals. So if while calf was in utero, if mama's plane of mineral was maybe questionable, or if we are concerned at all, I just recommend go ahead, whether it's a multimin or a BOCI injection. It's a very good idea for at the time of calving. Giving that at calving on this wet calf, that's going to last for you about 40 days. So it won't necessarily get you through until weaning. But if it gets the calf to that 40-day mark where they're starting to get curious and looking into feeders and those sorts of things, as long as your minerals are low enough that the calves can reach them, at that point they can start doing their own thing. You can castrate bull calves at this age. I know it seems just like a a wild idea, but if both of those little nuggets are there, you can put a band on that calf at the, at birth. It certainly is not going to hurt that calf. At that stage, when they're all slimy, they aren't feeling quite as much. So I think they're a little bit easier to band when they're slimy versus once they're a month or two old and their kicks really start to hurt. When you're castrating them at this stage, just make sure that you've got both of those testicles. And there is some information, I don't have the link posted here, but I could make it available, that by implanting these calves, once they get to a month of age, and maybe following that implant protocol as we go down the line, those calves can outperform calves that are castrated at 5 to 6 months of age. Because at 5 to 6 months, we're working with a much bigger sac, and it sets those calves back a little bit. So if you're concerned about the growth of these calves, but we also don't have a good way to handle them once they're 5 or 6 months of age, you can band them now. If you can nab them around a month, you can implant them, and they can do very well for you. And I'll talk a little bit more about implants. This is not an implant lecture. This isn't even a mineral lecture. I just figure if I'm going to put together a protocol for folks when it comes to vaccines, it's a good idea to talk about other things that we should be doing when we're handling these animals for vaccines. So, circling down to the vaccine component, we talked about the intranasal for respiratory. This is where you're going to see that CD&T vaccine. So again, this is a clostridial vaccine that has tetanus included. And this is a good idea, again, if mamas have never had a clostridial vaccine, or if we're castrating those bull calves around 1, 2, 3 months of age, you can go ahead and give them a CDT at this age. You can use an 8-way. 8 ways or 7 ways, those can be a little bit tough on calves, just in the sense of you'd be a little bit more likely to have a knot at that injection site. So I say that for anybody that's raising show stock. If you are wanting to do a tetanus vaccine at birth, you might prefer the CD&T just because it's a little bit calmer and less likely to give that calf a knot, but it'll still give you that tetanus coverage. And then I would recommend boostering that when you do castrate at a later date. But for those of you who are vaccinating your cows with an 8-way product, cows are very good about putting those clostridial antibodies into their colostrum. So if your cows are on a pretty good program, they'll transfer some of that through the colostrum. So again, that's why I say it's optional on there. The CD component of that CDT vaccine, that helps with overeating disease. So if anybody has calves that when they start nibbling in the creeps, they get bloaty or that they have some upset guts, again, a good idea to think about a CDT vaccine at birth to help a little bit with that component. And then again, a first defense bolus, that is optional, but it is potentially a great idea for anybody that's on that bedded pack in that barn and are having scouring calves. Generally, it's not the first calves of the season that you have those problems with. It's once you've got 1/3 to 2/3 the way in and you've got some older calves around those younger calves, a first defense bolus is an option that you would give this wet calf, and that is going to provide some immunity against types of scours. So I'm not going to dive into all those types. I will say there is a 2-way versus a tri-shield on those products, something that you can look into or reach out to your herd health veterinarian as far as diving into if you are having some scour problems. And if anybody is having any particular issues with calves, whether it is at birth or within that first month or 2 of age, I do have a slideshow that touches on getting them started on the right hoof. So if anyone is having a big problem with scours or anything like that, leave it in the chat. And once we wrap up, I can circle back to it. That way we just don't keep everybody all night. All right, so gonna keep clicking on through here. We've got our calves at birth, and then we're gonna think about our calves at maybe 2 to 3 months of age. These were the age of calves I was handling today. They were sassy little critters because they were just coming off mom. But if you are bringing cows up, and let's say you're setting cows up for a timed AI protocol, you're already going to be handling calves around this stage. So you could go ahead and start vaccinating them. So you could do a 5-way respiratory with Lepto. I've got modified live in parentheses because, again, what I want to echo is that if these calves are still nursing the dam and she has never seen a modified live product, by vaccinating these calves with a modified live, you can cause abortion if mom's naive. So if you have an unknown vaccine status of mama, and maybe, you know, once these calves are 3 months age, mom's already early bred, you might want to preference using a killed product at this stage. You can use their 8-way Castrate to make sure that we're getting some tetanus coverage. But if calves are already all castrated, or you've got some heifers in the group, the 7-way is okay as well. For smaller farms, I think it's easiest to keep one product around versus both a 7 and an 8-way Castrate vaccine. So the 8-way is absolutely fine for everybody to have. It's just a few more cents per dose. But again, like for my cows at home, I've got a dozen or so. So it's just easier for me to keep one product on hand. So my cows, my heifers, my well, now steers, they all got an 8-way. If they've not been castrated yet, this is a great time to castrate them, because at this stage you can castrate and implant. If you decide to implant, do know that not all implants are created the same. You would want to pick either a Ralgro or a calf implant. So like a Synovex C, a Revlor C, those stand for calf. So we want to make sure we're picking the calf implant at this stage so that we aren't amping them up too much. And then additionally, when we're handling them at this time in the spring, you can do a pour-on insecticide with a fly tag. When you fly tag, it's great to get it in both ears. And when you're picking fly tags, it is a good idea to make sure, you know, when you go to the store, you sometimes see, you know, orange ones, purple ones, that sort of thing. You want to rotate those fly tags about every year or every other year, just so that we don't end up with the insects getting a little resistance to those. So a good idea just to rotate the active ingredient in those products, or rotate the product that you're using. But great time to start putting some of those ear tags for your fly control in your calves, so you have a little less issue with pink eye. All right, and then one of the last times that we're likely handling them, this was actually this cute little guy. His name's Yellow Jacket. And he is up in Morrow County. So he was a guy that was getting castrated that day. So when they're about 4 to 6 months of age and we're weaning these calves, you can do your 5-way respiratory with Lepto. And at this stage, it's much safer using your modified live because they're coming off of mama. And this might be a booster for some of you if you were able to do this at 2 to 3 months of age. But I absolutely recommend that we should be getting that 5-way respiratory with Lepto to our calves. If you're a smaller group and you know you've just got maybe a dozen calves to do, just go ahead, give everybody your 5-way respiratory with Lepto, because I want our replacements to have that Lepto. If you're going to feed out all of those calves, you really just need the 5-way. Okay, so something to think about. Again, doing your 7 or 8-way Clostridial vaccine is a good idea. Then deworming these calves, because this is likely once we've got to the fall and they're coming off pasture. I really do like the oral or injectables. I know the pour-ons are so much more convenient, and I'll touch on why we prefer those orals on a later slide. But deworming these calves at this stage, and then if you had already implanted with your calf product when we handled them at 2 to 3 months of age, now that we are at 4 to 6 months, we can re-implant. Most of our implants are most effective within those first 60 days, and they typically don't last much longer than 90 days, especially the implants that we would use on this age of calf. So if you're backgrounding calves and sending them out to a pasture that you're going to supplement a little grain, you might want like a Revlor G for grass. Or maybe an intermediate steer, something along those lines, just making sure you're picking the right product. And then you can do a pour-on. I really recommend a pour-on, especially if they're going to be going into a barn or some sort of heavy feeding program. With those pour-ons, as you're coming into the barn for the winter, we tend to bring in some mange and some lice so you can get another pour at this stage. And you want to remove fly tags in their entirety. I see a lot of folks that just like to cut the tag and leave that bar in the animal's ear. But you want to make sure you're removing the entire tag. By leaving that little chunk in the animal's ear, we can actually, again, put low levels of permethrins and different things out into that environment for the fly. So remove the whole thing. Don't let those low levels hang around. All in and all out on those ear tags. Okay. So now I'm going to switch gears a little bit and talking about our calves at those different stages, and I'm going to touch base on our cows. So I really recommend that we give these vaccines pre-breeding. Ideally, we'd be one cycle ahead of when we're going to be setting those cows up. So a 5-way respiratory with Lepto, I recommend. In my opinion, Vibrio is optional. Vibrio is a disease that is transmitted by Bolus. We don't see it as much in Ohio. It is rampant when you start getting further out west. So again, it's going to depend on if you don't have a bull on your farm, you don't really need to vaccinate for Vibrio. If you've got some bulls roaming around, it is a good idea. But again, we don't see it nearly as much in Ohio as we do other places. There are some sales, like the Ohio cattle sale, they will make Vibrio a requirement in our vaccines. So just some ins and outs, but largely, I'd say 95% of the herds that I'm working with, we're doing a 5-way respiratory with Lepto. If you are utilizing a modified live, you really only need to do that once a year. That is going to have a long enough duration of immunity to protect that cow reproductively through her calving. If you're using a killed, I do recommend to my clients that we do that both in the spring and the fall, and especially in the fall if you've got a lot of animals coming and going. Let's say in the spring, we got all those mamas a killed product because we had different stages of pregnancy. We had some animals that were still pregnant. We had some that were early pregnant. We had some that were just right. So it was hard for us to select that modified live, and we decide, okay, for ease, we have to go with a killed because we don't have a great time for figuring out when we can get a modified live into all of our cows. But let's say we use that killed in the spring, and then all summer we've got calves coming and going to shows and doing different things like that, or through the fall when it starts into the best program. We really want to keep in mind that it's a good idea to booster those killed products because we tend to have anywhere from a 6 to 9 month reproductive duration of immunity. Meaning if I vaccinate my cows in late February, early March, by the time I get to the end of the year when that cow is heavy pregnant, I have no reproductive immunity anymore. So if IBR starts moving through my cows, I can have abortions from that. So a really good idea to booster that. A small digression that I'll make is that if you have heifers that received a modified live, and then as cows are getting killed yearly, that's actually a pretty good program. But to have just killed the entire lifetime of a cow, that does leave a little room for infection. I've had it happen twice where, you know, really aggressive folks, they were doing vaccines both in the spring and the fall, but these animals had only ever seen killed products, and we had some IBR issues with abortions. So really great at some point in that animal's life to make sure we get a modified live on board. With our 7-way Clostridial, that's what I recommend for cows, but again, they can absolutely get an 8 if it's easiest for you to carry one product. Similarly, pre-breeding, great time to do a pour-on and a fly tag. And I recommend that in the spring, all cows get an oral or an injectable dewormer. The reason that I want this in the spring is that we're getting ready to turn these cows out to pasture. So I want to deworm my mamas so that they are shedding less eggs out on the pasture, because those calves that are at their side are little vacuums. So by deworming mama in the spring, she's going to contaminate the pasture less, and you can put about an extra 10 pounds on your calf just by deworming mama in the spring. So a very good thing to think about. And the reason that I emphasize oral or injectable is twofold. One, cows, if you've ever watched them after a pour-on, they tend to go out and lick it off of each other. And there was a little study that was done looking at deworming cows, and they marked the dewormer and they looked to see how much dose the cow got based off what was off her back versus what she licked off her friends. And some of them were licking a good bit of their friend's dose off. And I typically tease to my students that I don't even know how many licks it takes to get to the center of a Tootsie Pop. So how could I expect a cow to know how many licks it takes to get her appropriate dose of dewormer off of another cow's back? So we've got some issue maybe a little bit with dosing strategy. One thing though that in Ohio we get away with are pour-ons because we have our winter. When we look at our friends down south that are in Georgia, they run into a lot of problems with resistance. like what we would see in our sheep and goats, that we have some problems here in Ohio. So in warmer environments where they don't get that deep freeze to kill some of those worms, they really have to only use our oral and our injectables. But in Ohio, again, if a deworming is only going to happen via pour-on, I understand, I get it. It's still much better than nothing. And in Ohio, we at least have that saving grace of a deep winter to help with some of those parasites that are out on pasture. So again, really recommend the oral if you can get that paste in the cow's mouth. That's great. If the deworming's only going to happen via a pour-on, I understand, much better than nothing, just to make sure those cows are getting dewormed when it comes to that that spring handling.
Alissa, I have a question about the dewormer.
Yeah.
I'm sure you've seen the blocks. It's like a lick. It's like a salt lick, but it's got deworming. How do you feel about using those?
So in cows, so that's going to be a fenbendazole that's in there. In cows, that Safeguard product, I would say it is effective, but if I were wanting to know that it did a good job, I wouldn't leave it out all the time. Leaving it out all the time is going to predispose parasites to developing resistance. So
Right.
if the block, let's say you don't have a way to handle your cows and the block is what you rely on, or the little pellets, you again don't free feed that all the time. You want
Right.
that to maybe hold them off mineral for a little bit, then put your block out so the cows really get a good dose off of it. So we don't want partial doses on that.
Right. Right. Now the next question's in the chat box, and it says, "Can you use Triangle 10 at 2 to 3 months?"
Yeah, your Triangle 10. I'm going to triple check really quick here. And you're saying at 2 to 3 months that cow is pregnant. She's been bred 2 to 3 months, so she'd be 60 to 90 days carrying calf. Is that, if you don't mind commenting there, if that's the...
Was that the question you're asking, Delaney?
Yeah, back to Delaney. Are you saying 2 to 3 months carrying calf?
Can I be unmuted for a second so I can answer the question?
Yep, go for it.
Okay, great. This is actually my dad's question. Dad, you're plenty welcome to.
Can you use Triangle 10 2 to 3 months after birth?
Yes. So when it comes to calves, I don't particularly, your intranasals are very safe. I don't recommend any vaccines to calves at about day 3 to 5. Calves, their immune system is doing weird things at day 3 to 5. So calves, when we are really, really, really early, you're fine going with that intranasal or the CDT. Don't do anything from day 3 to 5. And then I really prefer to wait, if I can, to have them be at least about 2 months of age before I'm doing those injectables. Your killed products are maybe a little safer. Some of our modified lives, those really can hit calves pretty hard. So it's great if we can wait till 2 months, but it's okay to go down to 1 month of age if you need to. Your Triangle 10, that's a killed product, so that is absolutely safe at that age.
Okay, the reason I was asking, because I was reading there and you had, 5 and 5, but you didn't combine the two to make the Triangle 10. So that's why I didn't know if...
Yeah, and I talked a little bit about that when I had a talking shop slide about all the different ways. So our 10-way vaccines, that's combining your 5-way respiratory with your 5-way Lepto. And your Triangle 10 has an HB product. So that actually has 6 different varieties of Lepto in it, but that is a killed product. So that's safe to use then.
So 2 to 3 months, we're in good shape, then we can, because the guy that does the banding or whatever, he likes to have that tetanus in there before he bands them, and that a couple weeks before so they don't get the tetanus.
Perfect. Nope, that is a great time for it. And with that killed product, again, you could sneak it down to a month of age if you needed to.
Okay, 2 to 3 months is good because that's about where we're at now. So
wonderful. But great question. I'm glad you asked. That way we could talk about timing of hitting those calves and what might be too early for them. So
yeah, because like I said, you said 5 on one and 5 on the other, but it didn't get to the 10 and that stuff. So, but thank you very much. It's a good answer.
Oh no, wonderful. I'm glad it helped.
Thank you.
All right. Anything else before we keep going on the cows here?
I don't see any more questions. Nope.
Okay, wonderful. So when it comes to our cows, again, we were just talking about if in the spring we used a killed product, we want to booster that in the fall. There are folks that, hey, I've got a closed herd. There's nobody coming and going. You're probably going to be fine getting away with that killed once yearly. I wouldn't have that tattooed on your arm by any means, but again, you're likely going to be fine if you have no cows coming back and forth. Not a big deal at all. However, if you've got some animals traveling or critters going to fair and coming back, I would absolutely recommend that you booster that with a killed product again in the fall. Doing a pour on again to take care of lice and mange on those cows, removing fly tags. And in the fall, you do not need to deworm everybody, just hit your skinny cows, okay? So when they're coming through, deworm those skinny cows, get them taken care of. All right. I'll click back on the presentation, there we go. So now talking about the handsome guys out there. I have a soft spot for bulls. I really enjoy them. So bulls pre-breeding, again, I like in my protocols, if there's something I kind of want my clients to make happen, I just put it in the protocol. That way they see the protocol and think about it. So I really do recommend breeding soundness exams on these guys. About 1 in 10 bulls are infertile. So that means 10% of the bulls that I check do not pass my BSC for one reason or another. They're either too young or they were sick, something along those lines. And even a lot of times I can look at that and say, hey, based off what I'm seeing on these slides, this is the guy that's got lots of modal swimmers. You can ask more of him versus, well, yes, he does pass today, but maybe put him with a smaller group of animals. So you can get a lot of information out of that. Very good idea to have breeding soundness exams done. Or let's say that your bull has been out with those cows and 3 weeks later you see them all coming back in heat. You can always have them tested after the fact too. Just don't wait the whole season to do it. That's what I beg of you. 2 weeks ago, I had a very disheartening afternoon where I went out and checked a group of 3-year-olds. 3 of 30 were pregnant. It was terrible. That bull clearly wasn't doing his job. So BSCs, they are a great idea. Bulls pre-breeding, I like to vaccinate them just like my cows. So a 5-way respiratory with Lepto, again, that makes it a 10-way. Vibrio is optional, especially in Ohio here, but if you are shipping bulls and they're going out west, I would plan on including that. Same deal, modified live, do it once yearly, killed, do in the spring and the fall. 7-way Clostridial, Pluron, fly tag, deworm, oral or injectable. Okay, so all of that is just echoing the cow. And again, you guys will have access to a Word document that writes all of this down. All right, in the fall, we're gonna do the same thing as our cows when it comes to the vaccines, pour on, removing fly tags. But what I want to draw your attention is for anybody that is raising and keeping their own bulls and has yearling bulls around, testosterone's a goofy thing and we don't quite understand how it affects the immune system. So there is a negative effect of testosterone when it comes to the immune system, and our yearling bulls can get extremely wormy. We really want to make sure that we are deworming any yearling bull on our property. They are going to be the most important animal to get dewormed in the fall when they're coming off pasture. So I'm thinking, you know, when it comes to dewormer in the fall, I want all my yearling bulls, I'd say your replacements, whoever's skinny when it comes to your heifers, all of your calves, and then skinny cows, okay? Not all cows need it. And then Carrie, do you know, is that Word document, is that already posted?
No, I just got it from you today,
Okay.
so I'll have to send it to our secretary tomorrow, and she'll probably post it tomorrow at some point.
Okay, got it. I was gonna say, I see there, oh, maybe I just saw part of the question, but yeah, there, oh, I just see you've got the answer in the chat. It'll be posted tomorrow.
Yep. And this will be posted too at some point when we get it. It may get emailed to you or it may get emailed to me since I made you the host. So we'll just have to keep an eye out in our email for it, the recording, but I'll post that as soon as I get it as well.
And I also sent Carrie the PDF of this. So if you aren't wanting to listen to it the whole time, you just need to flip back through, the PDF will be available.
Yes.
Okay. So our replacement heifers, again, you want to be thinking about this 4 to 6 weeks pre-breeding, hitting them with a modified live. So our 5-way respiratory with Lepto, again, that's a 10-way. So modified live on these girls is great. How I said before, if you can at least get a modified live into your heifers who don't have calves on their side or are potentially pregnant, getting this modified live in now And then once the water gets murky as cows and we've got bred ones and open ones, blah, 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 then we can rely on killeds as cows. And that's a reasonable program. So modified live to these heifers, a clostridial booster, especially if they're under 2 years of age. The 7-way is fine, but sometimes I've had goofy heifers that have cut themselves on the fence or stepped on stuff. I have had heifers that have got tetanus just by being goofy ladies. And then the rest is going to be the same as how we processed everybody else. Fly tag, deworm, pour on insecticide. Okay, what to do with any new animals that you buy. So when it comes to doing your vaccines, the options are up to you. You can use an intranasal or you can use an injectable. Your intranasal is going to provide protection much more quickly. So let's say you've got a mixed bag and you just know that this animal has been set up for failure, reach for the intranasal. Your intranasal is going to start providing some protection within about 72 hours. However, what you want to keep in mind is that that intranasal is probably going to give you good immunity for 6 months. It's not as good, it's not as long lasting as some of our injectable products. If they're coming into, came from a healthy herd that had a good vaccine protocol and they're coming into a healthy herd, you're fine just hitting them with the injectable product that you use. Those injectable products take about 2 weeks to give us immunity. Getting your cows with that 7-way clostridial, using any dewormers that you've got on and pour on insecticides, a metaphylaxis with an antibiotic. Again, that's going to be an optional thing, but it's going to pertain to what have we set this cow up for. If it's a mixed bag and you've had a little bit of respiratory disease and snuffles in your group, probably a good idea to pre-treat that cow when she comes into the group. There are some prescription drugs that do a great job with that are long acting, but even a simple LA200 that you can get over the counter would be fine. And preferably we'd keep them isolated at least for 7 to 10 days, preferably 2 weeks. Okay. These are vaccines that I did not touch on, but they are common vaccines that folks will add on. These to me are not essential. The ones that I discussed, I think, are a no-brainer that any beef, cow, calf, bull, etc., I think that they should have. But when we have our optional vaccines, our scour vaccines, those are designed to be given specifically when the cow is pregnant, about 3 to 4 months before she calves. And the first time that you use them, they require a booster. But if you know that you've got a problem, it might be worthwhile doing a little bit of testing to see what organism you're dealing with. But scour vaccines, those are designed to be given to the cow. It can be a little bit tricky, especially if we've got a wide breeding window, to know when is this cow going to be 3 months pre-breeding. So scour vaccines, overall, they do a nice job, but they work off the principle that we're going to vaccinate the cow before she has her calf and in enough time that she can respond to the vaccine, make antibodies, and include that in her colostrum. And she starts making that colostrum about 4 to 6 weeks before that calf comes out. So the timing of those are imperative. And if we're off on the timing, again, we're flushing money down the drain. Pink eye vaccines, it's a mixed bag with that. There's so many strains of pink eye. Sometimes our killed products can be a little bit helpful, but if you're really having a bad day, autogenous tends to go a little bit further. Our Pasteurella mannheimia vaccines, these can be good ideas for, I'd say, 2 groups of animals. One, feedlot animals. I think Pasteurella mannheimia is a great idea. This would be products like One Shot or Once PMH. But I also think it's a good idea for any calves that are on a circuit that are coming and going and seeing lots of other calves and going on the trailer in the cold and the freezing environments and then get to a heated barn. Really good idea to have a Pasteurella mannheimia vaccine. We talked about Vibrio being optional, and if you've got bulls, those are the guys that you want to use it on. Salmonella and others, I'm going to digress from there. Just wanted to say, here's some optional vaccines. Work with your herd health advisor to figure out when you would want to time those. Okay, now we're just going to get some tips and tricks of the trade. We're really winding down. So vaccination tips, I talked about this a little bit, but we don't want to vaccinate calves with a 5-way modified live in that first week of life. And again, I'm going to echo, I prefer to wait to 2 months if I can. When it comes to our boosters, we want to follow a 3-and-3 rule. When we're boostering a product, especially a killed product, if it's the first time that animal's ever seen it, that booster, we want to wait about 3 weeks because we want to give the immune system time to respond. Again, I said, anytime we use those injectables, it takes them about 2 weeks to get a good response. So we want them to respond to it. That way they don't just see it, you know, you do your initial, and if you booster within a week, that's still not enough time for that animal to say, oh, I remember you. So you want to wait at least 3 weeks and not much more than 3 months. After 3 months, it's not so much as a booster, and it's kind of the same deal where the immune system's going, have I met you before? I'm not sure. So to really get that good amnestic memory response, we want to follow the 3 and 3 rule. I do not recommend that we give vitamin injections with vaccines. Our vitamins, the carriers in those products, so let's say you want to do an ADE injection, the carriers in those products can be very inflammatory. So you're much more likely to have adverse reactions if you're doing vitamin injections at the same time as vaccines. Make sure you throw vaccines away after expiration dates. I will say, to get it on the table, I am guilty of using things after their expiration date, but for vaccines, please don't do that. Pitch them, get new. Again, we're relying on these tiny little proteins and handling and so many different factors. If we're just going to do it once a year, we want to do it right. So make sure you're discarding them after expiration dates. And let's say you're processing cows through the chute. I do recommend a clean needle for every cow, but I recognize that's not a reality in a lot of situations. So if you are not able to do a clean needle for every cow, but maybe you're using one of those big syringes that you can pull up, you know, these multi-dose syringes that you've got 10 doses in that syringe, at least I beg of you, go ahead anytime that you need to recharge that multi-dose syringe, put a clean needle on before you draw it up out of the tub. Because if you've got a group of 50 cows and the third one in that group had anaplasma, which we do see in Ohio, if the third one had anaplasma and you vaccinated those next 7 after her before you need to recharge your multi-dose syringe, well, at least you only gave it to the next 7. If after that you use the same needle and put it in the tub, now you've given anaplasma from cow 3 to cow 50. I'm being a little dramatic, but I have had anaplasma infect a bottle of oxytocin and work its way through a dairy. It was devastating. So you want to make sure anytime you're drawing up from the tub, just use a new needle. That way you can preserve that vaccine a little bit longer. All right. And then I always have folks that just say, but why? And that's when I pull the, because I said so, or, just, hey, just do it. It's important because I said so. That's the why. It is a good idea. All right, vaccines and reproduction. I talked about that first one a good bit, and now I'm going to drop down to that second bullet there. Modified live vaccines, if you are giving them on the same cycle of a timed AI, it can drop your conception by 35%. And that's a really, really bad day. Most of us want to really start ourselves up. We want to set ourselves up for success when it comes to our timed AI protocols. So do not vaccinate at the same time on that same cycle. I talked about before, we really want it to be about a month ahead of time, certainly at least 3 weeks. Even your killed products given that same cycle can drop conception rates about 17%. So very important to keep that in mind. And how I said, when it talks about using modified live in pregnant animals and even calves nursing cows, this is the label that is on that bottle. And this is just one product. I have Bovishield in there because that's what we carry at the practice. But any of your modified lives, that's an important thing to think about. But again, it's on the label. So if you're not sure if it's safe, look on the label. Then I'm just going to go and down to this picture that actually I got to process cows out there. That is at the foothills of the Rocky Mountains. It was such a glorious day. It was an awesome time for working beef cows down through there. All right, so a few more tips. No more than 2 gram-negative vaccines at once. I'm going to give you a list of gram-negatives, but don't do a lot of those at once, okay? Mineral deficiencies. If you vaccinate cows and you have a lot of adverse reactions of cows that are, totally off, or even worse, have anaphylactic reactions, one, make sure you check the handling of your vaccine, but it's important to recognize that cows that have extreme deficiencies can have increases in adverse reactions. So just a little nugget to keep in the back of your brain. Here are some samples of gram-negative vaccines. So like Lepto, which we talked about, that 5-way Lepto, that's a gram-negative. So I wouldn't want to do a Lepto vaccine with a pink eye vaccine with a Pasteurella mannheimia vaccine all on the same day. That's going to be a little bit too much for that animal. Similarly, our Clostridial product that I talked about, that actually is a gram-positive, but it counts as half. So when I'm doing my cow-calf products where I want my 5-way respiratory with my 5-way Lepto, that 10-way that has a gram-negative in it, then I'm doing the Clostridial, which counts as half. It would actually be a little bit too much probably to throw that to throw that mannheimia on board. They could handle it, but you might not get the response that you're looking for. So it's important to stagger some of these things, and this is just a list. Muci, I do count that as a gram-negative. Selenium can be a little bit tough on cows. I don't know if anyone has ever given it intramuscular and see a cow have a little seizure, but it can zap them a little bit. So I count that as a gram-negative as well. So don't stack these vaccines, okay? When to vaccinate. It's been a long time since we've seen any of these temperatures, but don't vaccinate when it's over 85 degrees. Or if our temperature humidity index is greater than 115. And we run into that in Ohio in the summer when it's so hot and humid out. So, you know, think about how that relative humidity might compound with our temperature. So over 85 degrees or THI is greater than 115. A question that I will have is, let's say that maybe it's not going to get to that temperature until noon. Can I do it that morning? Absolutely. You can process those cows that morning. But when it's 90 degrees out, it is so hot and you're going to overwhelm those cows. They're not going to respond well and you're going to see adverse reactions. And that's actually a lot. Your vaccine's probably going to get pretty warm. So don't do it over those temperatures. Okay. So